Hello, I'm Dr. Aizaz from MedicoVisual.com, and in today's visual lecture we will talk about the development of middle ear cavity, and along with that we will also talk about the formation of ossicles and the external ear in the upcoming part of the lecture. So here you can see that we have this part of embryo. Of course it was a full embryo and we are showing just a part of it. Let me explain it here for you that it was somewhat like this, that here is its tail end, the caudal end, right? So we have just removed the caudal part and we are looking at its cranial part. Now this is the folded embryo, right? But the pharyngeal arches, they haven't formed yet in this embryo. Now what will happen that we will first take a section of this, and inside we can see here that there is these internal ear, right and left internal ear. Now if we talk about hearing, of course the valence part, it does not need any external connection. It is on its own, it is working just inside the internal ear, it is still working. But for the hearing we need the sound waves to enter into the cochlea. So sound waves must enter into the cochlea, and for that we have that oval window. I think I haven't drawn it. It must be somewhat here. So yeah, we have the oval window, but the problem is that the internal ear is deeply seated inside the skull, in the petrous part of temporal bone. It is deeply seated within the bone. So within the bone, it is difficult for the sound waves to enter, to penetrate through the bone. Bone conduction is not very efficient, so air conduction must be provided. The air that contains the sound waves, it must enter somehow into the cochlea. So sound waves, there must be a way for the sound waves to enter into the cochlea. So for that we need the external auditory meatus and middle ear cavity. This is the basic introduction, that why we need these structures. Now we will talk about that how they form. But before that, as we have discussed previously in the lecture of formation of pharyngeal arches, that how the pharyngeal arches form. Now in this lecture I'm not gonna explain that how the pharyngeal arches form. If you want to understand that, you can watch that lecture. And here let's see the animation. So here you can see the pharyngeal arches formed, and along with that the pharyngeal pouches formed. Basically the pharyngeal pouches, these are nothing more than the outpocketings from the primitive pharynx. So here you can see this is the GI tube, gastrointestinal tube, this yellow one, and it is endodermal in origin, and from its lateral wall these outpocketings form, and these outpocketings are the pharyngeal pouches. Now the first pharyngeal pouch is important in this discussion, so we will hide other pharyngeal pouches and let's just focus on the first pharyngeal pouch. So it is a simplified depiction, very simplified depiction of first pharyngeal pouch, right and left first pharyngeal pouch, and it is between the first and second pharyngeal arch. So both of these, this and this, these are both all the swellings from the first pharyngeal pouch, pharyngeal arch. Then this is the second pharyngeal arch, third, fourth, and this is sixth. There is no fifth pharyngeal arch. Again, if you are still confused about this discussion of pharyngeal arches, please watch my detailed lecture on the pharyngeal arches, and it is available for free on YouTube. Please do watch that first if you are not able to understand this. So anyhow, the first pharyngeal pouch is important in our discussion. Now to make the orientation more clear, let's rotate this embryo. So now we have rotated the embryo, and now the orientation is more clear, that this is the lateral side, this is the medial side, and here is the cranial side, here is the caudal side. Now what really happens that here is, as I have told you, the one of the swelling, this is the maxillary swelling and this is the mandibular swelling. Both belong to first arch. This is the mandibular swelling, this is maxillary swelling of first pharyngeal arch, and then here is this one is the second pharyngeal arch. Now between the first and second pharyngeal arch, here there is a cleft. You see there is this depression or cleft here. This cleft or depression is first pharyngeal cleft. Similarly, between second and third we have second pharyngeal cleft, fourth, and so on. This is the basic concept of pharyngeal cleft. Now from the dorsal end of first pharyngeal cleft, the external auditory meatus develops. Now how it develops, let me show you the animation. So here you can see a finger-like process arises from this first pharyngeal cleft, and it moves medially. This finger-like extension, it moves medially from this lateral wall, from the dorsal end of first pharyngeal cleft. It moves medially towards the cochlea. So here it hasn't reached to the up to the cochlea, up to the internal ear, but it tries to go towards the internal ear, and this is initially a solid rod. Let me explain it for you. If we take a section of this, initially it's a solid cord like this. It's a solid cord, right? Initially it's a solid cord like this. Then what will happen, that the cells within this solid cord, in the center of this solid cord, some cells begin to die. So what will happen, that canalization will occur. Let me explain it for you. So within the center some cells will die and only the walls will remain. So this is called canalization. So canalization of this will occur. Now we have the external auditory meatus that has been formed. So this is the external auditory meatus. So that's how it forms. The important thing that you must remember, that this external auditory meatus, it developed from the dorsal end of first pharyngeal arch. And by the way, yes, most of the textbooks, most of the authors, they agree that it develops from the dorsal end of first pharyngeal arch, but one of the author, the Langman embryology books author, it says that it does not form from the first pharyngeal cleft, but rather from the first pharyngeal arch. Somewhere from the first pharyngeal arch an inward extension develops, and that leads to formation of external auditory meatus. Although the more common idea, the more common concept is that it develops from the dorsal end of first pharyngeal cleft. Now as you can see, it didn't almost touch the internal ear or the cochlea, so it is not enough to transmit the sound waves to the cochlea. So how the sound waves then will be transmitted to the cochlea? To fill this gap, this first pharyngeal pouch will render its services here. It will say, okay, don't worry, I am here. It will say that I will extend up to here to form another cavity here. Let me show you the animation and then it will become very clear. And by the way, as this first pharyngeal pouch, it begins to extend towards here, this extension, this first pharyngeal pouch which will form the extension, this extension is now called as tubotympanic recess. Tubo means there is a tube and tympanic means related with ear. So what we call as, it forms the tubotympanic recess. I hope the spelling of recess are correct. So anyhow, so tubotympanic recess. Now what will happen, that let's watch the animation and then I will explain these things to you. So here you can see that this extension from this tubotympanic recess, it went closer to this internal ear, and then this distal end, it dilated to form a cavity, and this cavity is the primordium of middle ear cavity. And then there is a tube here. This tube connects the anterior end of the first pharyngeal. If you see here, this is the anterior side, this is ventral or anterior side, this is the dorsal side. So you see, this is the middle ear cavity and its anterior or inferior end, it is connected to this primitive pharynx. This is going to form the pharynx. So it is connected to the primitive pharynx. This middle ear cavity is connected to the primitive pharynx through this tube that has been formed, and this tube is called auditory tube or pharyngotympanic tube. What it is called? It is connecting the it is called auditory tube, and because it is connecting the tympanic means middle ear cavity, tympanic cavity, middle ear cavity. So it is connecting the pharynx with the middle ear cavity, so it is called pharyngotympanic cavity. Not cavity, sorry, it is pharyngotympanic tube. This is a tube like structure. So this is tympanic cavity and this is pharynx. So pharyngotympanic cavity, and sometimes this cavity might not cavity, I don't know why I am again and again saying cavity. It is tube, pharyngotympanic tube. So sometimes what happens that this pharyngotympanic tube, sometimes due to infection, it's proximal end, it might get blocked, and the fluid may fill into this tympanic cavity, or ascending infection might also travel through this auditory tube or pharyngotympanic tube. And by the way, it has also got another name, I just remember. It is also called Eustachian tube. So it has got several different names. So anyhow, now we have this external connection. So from the external environment, the sound waves can travel inside, and from here they can go through the auditory meatus, external auditory meatus, to the middle ear cavity, and ultimately here there will be the oval window. They may go into oval window, and then the sound waves might travel to the cochlea, and they will stimulate the cochlea, and sound might be heard. And by the way, we will later also see that here the pinna of external ear will also develop, which is also called auricle. So that external ear that you see from outside, that is pinna of external ear or auricle, that will also develop to collect the sound waves. That is like a funneling system that will connect the sound waves and take up here. Now here there is a little problem for us. Now you see that the cochlea is filled with a fluid. It is filled with perilymph. But the sound waves inside the external auditory meatus and inside the middle ear cavity or tympanic cavity, we have air. We have air, and in the internal ear we have water. We have fluid, perilymph and endolymph. Now the problem is that the resistance that is offered to movement by the air is much lower as compared to resistance that is offered to movement by the fluid. To understand this, imagine that you move your hand freely in the air, and your hand can easily move in the air because air does not offer too much impedance or resistance to the movement of your hand. But if you take your same hand and if you try to move your hand in a bucket full of water, then what will happen that it will become slightly difficult to move your hand. This is because the fluid or water, it offers greater resistance to movement. It offers greater impedance to movement as compared to air. Air has less impedance, fluid has higher resistance, higher impedance. So that is the problem that must be solved. And this problem is solved by what we call as the process of impedance matching. And for impedance matching, we have 3 small bones in our ear. They are called ossicle bones. I will just tell you how do they work, but before that, let me tell you that how they are formed. How these ossicles develop. We have the pharyngeal cartilages. Each pharyngeal arch has a cartilage, and these cartilage, they are formed from the neural crest cells. We have discussed these things previously in the lecture of pharyngeal arches. Now the pharyngeal arch cartilage of the first arch and second arch, they form these middle ear bones or ossicles. So you see, from the first pharyngeal arch cartilage, the first middle ear bone, which is called Malleus, this is the Malleus and this is the Incus. So Malleus and Incus, they develop from the first pharyngeal arch cartilage, while the third bone, that is called Stapes, it develops from the second pharyngeal arch cartilage. And later we will see that there are some associated muscles as well with these ossicles that also develop from the first and second pharyngeal arch cartilage. Now here let me tell you an interesting thing, that in literature sometimes they write that these middle ear bones, they develop from the neural crest cells or mesenchyme derived from the neural crest cells. But in other textbooks they say that these ossicles, they develop from the first and second pharyngeal arch cartilage. Then you might get confused that whether they develop from the cartilage or whether they develop from the mesenchyme that is derived from the neural crest cells. Well, it doesn't matter, both of these things mean the same. This cartilage is basically derived from the neural crest cells, and its mesenchyme is the neural crest mesenchyme. If you say neural crest mesenchyme of the pharyngeal arch cartilage, this is just the same thing. It's nothing new, or there is no difference in that. So this is just a mean of confusing you people. The textbook, they do it like that. I don't know why they confuse my dear medical students. So anyhow, that's how the middle ear bones develop. But briefly let me tell you that how these ossicles, how do they work? I'm not gonna go into details, but slightly we will focus on the impedance matching concept. That is an important concept in physiology that most of the people do not understand. So here are these middle ear bones, the ossicles, the Malleus, Incus and Stapes. Now if you see here that here there will be the tympanic membrane will form, and here there will be pinna of ear. So sound waves are entering here, right? And here is this long arm of Malleus. This is the long processor arm of Malleus, and here also the long arm of Incus. This is Incus. Basically it's called acronym Malleus, Incus, Stapes. So the long arm of Malleus is much longer as compared to long arm of Incus. This provides a lever advantage. Let me tell you how. If we rotate it like this, let me show you the animation. So if we rotate it like this is just a hypothetical. Of course it does not work like that. Let's imagine that we are rotating these bones like that, and now if we put a lever here, now you can see this is equal to this. Here the fulcrum forms the moment, the axis of rotation. This is the axis of rotation. So you see this is the axis of rotation, and here is the long arm of Malleus, and here is the long arm of Incus. Now because the long arm of Malleus is longer, so if we apply less force here, it will result in more force here. So even if there is very little amount of force that is applied here due to movement of sound waves into the tympanic membrane, if there is only a little movement of tympanic membrane, little intensity movement, I should not say little movement, but if there is little force of movement here, little force of movement at the tympanic membrane and at the Malleus, if there is little movement here, due to this lever advantage, there will be more intensity force here. So more force is required here to move. Here there will be the cochlea, so more force is required to move the fluid within the cochlea. So naturally, due to this lever advantage, more force is generated here. This is one mechanism. I know it's slightly complicated, and we will talk about it in detail when we will talk about physiology. The other mechanism is that tympanic membrane is bigger but oval window is smaller. That is not due to this ossicle, but because of larger tympanic membrane and smaller oval window, you can understand it like that the waves, the force, it is sort of focused. There is increased pressure here. So due to this focusing thing, there is there is a quite efficient impedance matching. I know again it's complicated mechanism, and if you fail to understand, do not worry, we will talk about its mathematics and its biophysics and physiology in the physiology of ear. This is not the topic of today's discussion because it's a whole different topic and it is very complicated to talk about in embryology. Again, don't worry, I will explain it in physiology. Now here let's assume that the pinna of air has been formed and we have this middle ear cavity. This is the external auditory meatus and here is the middle ear cavity with the auditory tube or eustachian tube or tympanic pharyngotympanic tube here, and these are the ossicles. Now basically you can see that ossicles, they are lying above the middle ear cavity. They are lying on the top of tympanic cavity. They are not inside the tympanic cavity. They should be ideally inside the tympanic cavity. So how can we send them inside the tympanic cavity? Again, here the nature has been very kind to us and it has provided a beautiful mechanism for this. And what is that? That this tympanic, this top end, the cranial end of this tympanic cavity, it will extend upward. And what will happen, here I have removed the anterior wall to make you understand. So it will extend upward and it will sort of engulf these bones like this, right? So as it has engulfed these bones, what will happen that ultimately this most of it will be lost and some part of it will be forming the coverings of these bones. So you see these bones are internally lined by this epithelial layer. So this epithelial layer will be formed. Along with that, some ligaments that keep these bones within these bones almost, they allow slight movement within this tympanic cavity, but somehow they keep them fixed in position within the tympanic cavity. There are some other ligaments as well, but I have shown only the two. So these ligaments as well as the covering, this is derived from this mesentery-like covering. You see, this is a mesentery-like covering. So that's how these bones, they come inside the tympanic cavity, and that's how these coverings and the ligaments develop. And by the way, this upper part that forms by the extension, this upper part of tympanic cavity, it is called epitympanic recess. It is called epitympanic. Epi means above. Recess is sort of, you can say, an extension. So it is extension of tympanic cavity which is above the original primordial tympanic cavity. Original primordial tympanic cavity was somewhat here. So it is an extension that is above it. So epitympanic recess. And how it develops, that I have explained. But along with that, let me tell you that how there are some muscles also within that also develop. And before that, let me tell you that what are the mastoid air cells. From its posterior wall, an extension develops, and this extension forms these mastoid air cells. Basically, the mastoid air cells, it is just a connection of, it is a interconnected network of cavities within the bone of mastoid bone. Within the mastoid bone, there are these interconnected cavities, a collection of interconnected cavities. These are called mastoid air cells, and these are internally lined by this extension of tympanic cavity. And here is this opening called antrum, mastoid antrum. It is opening in the tubotympanic recess, epitympanic recess. It is the opening in the epitympanic recess, and this opening leads to these mastoid air cells. Its proper function, their proper function is not known, but one of the hypotheses is that they regulate the air pressure. Again, I am not really sure that how do they maintain the air pressure and what is the significance of that. I am not sure about the details. We might research a bit on this when we will talk about physiology, but right now I am not really sure. So anyhow, these are the formation of mastoid air cells. Then finally, some muscles they also develop. For example, here the stapes, it is connected to the posterior wall of the tympanic cavity through this muscle called Stapedius, and here is the tensor tympani. Actually, there is another canal here. Above the pharyngotympanic tube, there is a canal, and this canal is called canal for tensor tympani muscle. This is the tensor tympani muscle. This canal, within this canal, this muscle is there, and again, I am not sure that how this canal develops, but again, one of the hypotheses is that there is that interior wall, and from the interior wall again a finger-like extension will form, and this extension will canalize to form this canal. Because I'm not really sure about the exact mechanism, so I didn't made the animation of this. So anyhow, there is this muscle called tensor tympani muscle, and this muscle, it sort of, you can see it tilts medially as it goes backward. This is the interior end. As it goes backward, here there is a hook-like process called process cochleiformis. This is called process cochleiformis, and this, it rotates this tensor tympani muscle, and finally it is attached to the Malleus, handle of Malleus, this long process or handle of Malleus. It is attached to long process or handle of Malleus. Now, function of both of these muscles, by the way, this tensor tympani muscle, it originates from the first pharyngeal arch, while the stapedius muscle, it originates from the second pharyngeal arch. Now, the function of tensor tympani muscle and stapedius, both of these muscles, is that as these muscles contract, and they contract as a result of very loud sounds. So as a result, when there is a loud sound, they will contract, and this will move the handle of Malleus slightly medially. And stapedius muscle, it will also move the Malleus, that's the stapes bone, it will move the stapes bone medially. So what will happen, that there will be somewhat tension will be created in these ossicles, and it will transmit less sound. So it prevents sort of damage to the ear, that due to very loud sounds the ear may be damaged. So the movement in the ossicles will be reduced as a result of action of these muscles. Again, we will talk about details in physiology, but this is the basic idea. Now, the formation of epitympanic crease is one of the hypotheses I already explained to you, but there is another alternate hypothesis as well. Let me tell you the alternate hypothesis of formation of epitympanic creases. So one of the mechanisms that I have already told you about the formation of epitympanic creases is that it extends upward and mesentery-like process is found. But some of the textbooks, they mention a relatively newly discovered mechanism, and again it is a hypothesis, we are again not 100% sure. And this mechanism is that this roof of primordial tympanic cavity, it is lost. This roof is lost, and what will happen, that all around there is mesenchyme. It is surrounded by mesenchyme, the mesenchyme that arises from the neural crest cells. So what will happen, that mesenchyme will surround it, and this mesenchyme will form the covering ligaments as well as the epitympanic creases, the new part of the tympanic cavity, which is epitympanic creases. Its wall will be created by this mesenchyme. And one of the important evidence that this hypothesis is true is that the ear is filled with this mesenchyme even up to 2 years of age of the baby, up to 2 years after birth, 2 years after birth of the baby. The ear, the middle ear cavity, is somewhat filled with this mesenchyme, and this does not allow a full movement of the ossicles, and ultimately, of course, this mesenchyme is lost. So in a nutshell, there are two plausible mechanisms of formation of epitympanic creases. One is simple, that there is upward extension of the primordial tympanic cavity, and other is that roof of primordial tympanic cavity is lost, and epitympanic creases and other related structures, the coverings of these ossicles and ligaments and walls of epitympanic creases, it is found by the mesenchyme, and of course mesenchyme is also filling this tympanic cavity. So that's how the tympanic cavity, middle ear cavity, develops. And finally, yes, one important thing that I forgot to mention, what about the tympanic membrane? Tympanic membrane has 3 layers, and they are formed by the innermost layer. You can see innermost layer is formed by this pharyngeal cleft. So you see there is that finger-like extension of dorsal end of first pharyngeal cleft that went inward to form the external auditory meatus. So its epithelium will contribute to the tympanic cavity. The other contribution is by this wall. the tympanic cavity wall, right? And which is derived from the endoderm. You see the pharynx, the tubotympanic recess. The tubotympanic recess is endodermal in origin. So we have endoderm that contributes, and here this is the ectoderm. So we have ectoderm. So ectoderm, endoderm, and then between them we have some mesenchyme here. So we have ectodermal component, we have endodermal component, and we have mesodermal component. All three components, they contribute towards the formation of tympanic membrane. This is the tympanic membrane. So tympanic membrane is formed by 3 layers, tympanic membrane. So that was about the formation of middle ear cavity, tympanic membrane, and related structures. Now we will briefly talk about the formation of pinna of external ear or auricle of the external ear. So again, here is the pharyngeal arches, and here you can see the external auditory meatus is there. Here it is, this hole is leading into the external auditory meatus. Now around this hole, within the first and second pharyngeal arch, we have the swellings, 6 swellings developed. These are called auricle hillocks. Let me show you. So you see these blob-like swellings, 1, 2, 3, 4, 5, 6, 3 swellings on the first pharyngeal arch and 3 on the second pharyngeal arch. These swellings develop, and these swellings, they gradually leads to formation of the external ear, auricular hillocks. How do they form? Basically, the mesenchyme below it proliferates, and this ectoderm is lifted upward. Let me show you. So here initially it was flat ectoderm, and below that was the mesenchyme. Now mesenchyme proliferates below that. This mesenchyme proliferated like this to form these blobs like structure. These blobs, these are called auricular hillocks, and these auricular hillocks, they ultimately form the pinna of the ear. Now how do they form, and which of the auricular hillock, which of these phalanx, which form the which component of the ear, that I will not tell you. Why? The reason is that it is controversial. Some of the textbooks, they say this part is called tragus. This is the tragus of the ear. Some textbooks say that only the tragus of the auricle, the pinna, only the tragus of the pinna, only that develops from the first three swellings, the swellings that develop on the first pharyngeal arch. Only the tragus develops. But again, as I told you, this is controversial. The other textbooks, they say that this half of the ear, it develops from the first 3 swellings that develop on this first pharyngeal arch, and this other half, it is derived from the other 3 swellings. So again, it is quite controversial, so I'm not gonna go into details, but briefly let's talk about the parts of this pinna of ear. Let me isolate this for you, and let me tell you the parts of the ear, parts of the auricle. So here you can see there is this curved end, the curved superior end. By the way, I sculpted it yesterday. I'm not an expert in sculpting on Blender, so it's not a perfect sculpting, but anyhow, this is the helix, not helix. This is called helix of the ear. This is the helix. This curve like thing is called helix, right? And then we have here another curvature, which is not exactly against the helix. It is lying very close to helix, but still it is called anti-helix. It is not enemy of helix, but still it is called anti-helix. So here is another curve. Here this is called anti-helix. Then we have, and by the way, helix goes somewhat here, and it is somewhat lost into this. It is merged into this depression here. Then we have the tragus here. Let me show you. This is the tragus. This flap like tissue is called tragus, And then we have another slightly smaller flap. It is called antitragus. Antitragus. Again, it is not against the tragus, but still it is called antitragus. And then here we have lobule. Lobule. And this depression is called concha. This is called concha. And then we have the external auditory meatus, that is opening of external auditory meatus here. So here is the opening of external auditory meatus. That is an opening that is leading to external auditory meatus. I don't know if you can see it here. It's hard to visualize because it is covered by the tragus and antitragus. So anyhow, these are the parts of ear. I hope you can understand. There is slight depression as well here between these two forks of these two parts of the antihelix. So this was about the development of middle ear cavity and external ear. Thank you so much for watching this video.